I'm Dr. Ed Glaser. Plantar fasciitis is one of the most common and painful conditions that affect the foot. I've dedicated much of my professional practice to treating it over the last 28 years. So what is plantar fasciitis? Plantar fasciitis is the pain and inflammation that occurs in the arch of your foot, usually near the heel. Most people who suffer from plantar fasciitis complain of a very painful first step in the morning. It often hurts after sitting for long periods of time. Runners often complain of pain before and after running. The pain is described as a sharp, burning, heel or arch pain. This pain will be easy to recreate with a simple test where the bottom of the foot is pressed while the ankle and big toe are pulled up. So what causes plantar fasciitis? The plantar fascia is a ligament in the bottom of your foot that supports your arch. Plantar fasciitis is caused by too much tension on this ligament. Your plantar fascia is like the string on a bow and arrow, and the arch of your foot is the bow. When your arch drops, the tension on the plantar fascia, or bowstring, increases with every step. In part, this is because the foot is getting longer. This excess tension causes your plantar fascia to become inflamed, most commonly where it attaches to the heel bone. You see, all day long with each step, you're tearing the ligament away from the bone. The intermittent pressure of walking and standing milks out the inflammation, so it doesn't hurt much while you're on your feet, except maybe at the end of the day when it catches up to you. When you get off your feet at night, there's no pressure on your feet, so the inflammation can occur. And that first step in the morning, on the inflamed heel, it almost feels like you stepped on a nail. It can be very painful. Only plantar fasciitis will cause this first step kind of pain. Sometimes we see a spur on X-ray, depending on how long you've had it. We call that spur a heel spur, and it shows that this type of tearing has been going on a long time. So plantar fasciitis is what happens as your arch drops. It tells you that you're in the process of dropping the arch. A fallen arch will bring on many other painful foot, ankle, knee, hip, and back problems. Just to name a few: bunions, hammer toes, Taylor's bunions, neuromas, calluses, corns, shin splints, ankle sprains, knee pain, etc., etc. In fact, that's the etc. in plantar fasciitis, etc. So what can be done about plantar fasciitis? Unfortunately, many people continue to suffer plantar fasciitis until the tension on their plantar fascia is relieved. If a collapsed arch increases the tension on the plantar fascia, then raising the arch back to its correct height will reduce it. This should be the goal of treatment. Only a good orthotic can create this change, and all orthotics are not created equal. Typically, what are called custom orthotics do not even try to raise the arch. Most medical professionals cast the foot in a position where the arch is already halfway collapsed. This orthotic has no chance of supporting the arch correctly and relieving the tension on the plantar fascia. Many doctors have given up on custom arch supports and have gone to off-the-shelf shoe inserts or prefabs. Because the correct arch position varies dramatically from person to person, prefabricated inserts have to play it safe by giving only minimal arch support. They also cannot be calibrated because body weight, flexibility, and activity levels vary from person to person. So they're all made too flexible and simply flatten with your feet. Recent studies have shown that custom orthotics cast in this half-collapsed position and the prefabricated orthotics you can buy at the drugstore produce the same poor results in changing the way your foot moves when you walk. It's the height of the arch, or foot posture, that controls the way the foot functions. People with good foot posture usually have little trouble out of their feet. People with poor foot posture develop all kinds of painful foot problems. At Plantar Fasciitis, etc., using sole supports, full contact orthotics, we restore correct foot posture to relieve the tension on your plantar fascia. We simply raise your arch, bending the bow and loosening the pull on the bowstring. Only sole supports are calibrated to your body weight, foot flexibility, and lifestyle. To correctly calibrate the orthotic, our podiatric examiner will evaluate your foot's flexibility and check your body weight.